Welcome, McDougalers all over the world. And my name is Gustavo Tolosa. I'm here in Dallas, Texas. I am the webinar specialist and host for Dr. McDougall and Chef AJ. Some of you also know that I am a concert pianist and teacher who lost about a little over 70 pounds about 3 years ago, attending the 10-day living program in Santa Rosa, California, and I have kept them off. I regained my health, and now I have a passion for bringing you this life-saving information. And today we have a very special guest. Before I introduce him to you, I want to announce that this webinar is being recorded as usual, and it will be available at drmcdougalls.com. And I would like to take just a minute while everybody is logging in. I see a lot of people logging in right now. And I want to show you the website. Here under education, you can see the live with Dr. McDougall online webinars, and you can see all of the past webinars available for you to watch any time of the day. And you always have the new webinars where you can sign up for the current week or the next week. Just notice that next week we have another guest, Dr. Doug Lyle, and he is giving another one of his great presentations called Dare to be Lousy. So it's really intriguing. And let's see what else we have here. Then after that, we will have Dr. John McDougall back. I do want to point out that under programs, there is a 3-day advanced study, a 3-day intensive program coming up very soon in May, and I am excited that I will be in Santa Rosa. And then there is another 10-day living program coming up as well in June, and I want to encourage you to attend. Those are truly life-saving and changing events, and I hope that you will be able to attend. So I will stop sharing the screen. And today we have Dr. John McDougall's son, Dr. Craig McDougall. And what can we say? I will let him go ahead and tell us a little bit about his background, where he's been working up to now, and his new practice. Welcome, Dr. Craig McDougall. We're very excited to have you here today.
All right, thank you, Gustavo. It's really a pleasure to be here and be able to be on this webinar and share with you a little bit about what I've been up to. As Gustavo said, I'm a physician, so I'm a board-certified internist. I went to Ohio State for medical school, and then I came out to Oregon, and I went to Oregon Health and Sciences University for internal medicine. After I graduated from internal medicine, I went to work at Kaiser Permanente in the Northwest region. I was there for about 3 years. There, I had the wonderful opportunity to start a new type of clinic there, and I was a co-developer for a lifestyle medicine clinic that we saw people and helped them get off medications, lower their blood pressure, cholesterol, blood sugars, really improve their health using a whole food plant-based diet. While I was there, in the last year that I was there, why I actually ended up leaving was I was approached by a different company within the Portland, Oregon area, and they asked me to come and lead up their primary care division at a company called Zoom Plus, formerly known as Zoom Care. They're a company that used to be do just urgent care. And they've done urgent care in the Portland area and Seattle area for the last 10 years. And in the last year, they expanded to provide complete care. And so they started their own insurance, primary care, pediatrics, specialty care, and also their urgent care as well. I'm probably missing something. I think we also have a super clinic, which is like an ER. But so at the primary care division that I'm leading up is I started up a clinic for primary care for adult medicine. And we wanted to really do things a little bit differently than what's been done before. And the way that my background and the mentors that I've had, I've kind of learned to do things a little bit differently than probably is done in most primary care practices, which is taking a more conservative approach, a evidence-based approach, and really trying to use food and movement first before resorting to pills and procedures. And so that's kind of the foundational philosophy that I'm building this practice with. And then we also want to help those people that need a little bit extra help, the patients who come and see us for primary care that need a little bit extra help. So we developed a program, an outpatient program that we do here that helps people implement more whole plant foods into their diet and move them across the spectrum towards a whole plant-based diet to help them prevent or even reverse chronic conditions. So in our program, we do one-on-one visits with people, and so I meet with people on a weekly basis to help with support and guidance and kind of give them a little bit more structure. We start with kind of the basics. We go to the grocery store, talk about food label reading, we talk about eating out, and we talk about meal planning as well. And these are also incorporated with group visits, and our group visits are focused on more the practical of preparing these foods. And so we have 4 different group visits. One of them's about focused on kind of like basics, like stocking the pantry, stocking the refrigerator, and also talking about making familiar flavors and sauces, dressings, kind of oil-free dressings, and also plant-based milks, making your own plant-based milks. And then our other 3 classes are centered around different starches. So we have a class centered around legumes, and a class centered around whole grains, and also a class centered around root vegetables. And those, each one of those classes are going to reinforce the same type of topics that we talk about in our one-on-one sessions. And then those are going to also rotate seasonally as well. So every season will be a different recipe and a different featured root, legume, or whole grain to help kind of keep people that support an ongoing connection for returning to the program. So that's kind of like the overall kind of structure of what we're doing at our clinic, and things are going well. We're expanding our hours and expanding our days because we're starting to get to that point where we can expand our practice. I'm hiring another full-time provider to work with me, and I also have a part-time provider, and then brought on a dietitian to help me with the group classes as well. So. Now, people overall, I think, are responding very well to kind of our approach. I wouldn't say that everybody is necessarily ready to adopt a plant-based diet, but that's okay. We're there to help everybody, and not everybody necessarily needs the more intensive program too. So we do we do a lot of just kind of general primary care and helping support people, but still trying to encourage them to make lifestyle changes as our primary starting place.
Very good. Very good. I think I'm moving to Portland. What a wonderful program you have there. We can hear a little echo because I don't know if you could turn down your volume.
Yes, I can.
Yes, that way it doesn't come out. Okay, very good. How can people contact you who live in the area and would like to become your patient? Do you have a website, email, Facebook, phone number?
I think the best way is probably online. One of the things that the tenants that they use that they're in this company is really on-demand scheduling. So people can schedule on their phone or schedule online whenever they'd like. So it's like the appointments are always like the same day appointments, and for on-demand scheduling for everything that we do. The same with the primary care as well. So if people go to zoomcare.com. They can find my service line under Zoom Plus Prime is what it's called, or Zoom Prime, and that's the primary care, adult primary care service line. You can also go to zoomcare.com/prime, and that would also take you to the scheduling for our clinic as well. The phone number is, I think it's 844-966-6777. And
could you repeat that one more time?
Yeah, it's 844-966-6777, is the company's 800 number that people can call and schedule through there too. I think the easiest way is always kind of online or through our app that they have as well.
Right. I have put that in the screen. I know of a couple of people that have already mentioned that through my Facebook page and an email that they're looking forward to becoming your patient. So that's great. So it must be a challenge to get a patient who has never heard about a plant-based diet, who's coming to see you thinking that they're going to get the traditional approach. How do you handle that challenge?
I mean, I think that it's, when I meet a patient, I mean, the first thing that I think that I try to kind of go through with them is really just trying to discuss the overall medical condition and kind of the approach that they've taken so far. Just kind of getting to know. And, a lot of people, the kind of traditional practice has been to start medications, control the numbers. But unfortunately, rarely do we see people actually improve their health with these. They may improve their numbers, but the marginal effects that people get in the long-term outcomes is something that I don't think people are necessarily aware of. And then even looking at some of the medications that that we have, I mean, oftentimes the best results that we get is 1 person out of 100 is getting benefit from these. And so I like to go through some of this information with my patients when we kind of start, kind of just setting out the playing field. And really trying to encourage them to really take a different kind of mindset around their condition, whether it be diabetes, high blood pressure, or high cholesterol, and reframing, focusing more on the cause and the root cause of things, and trying to refocus things just on lifestyle. Then after we've kind of started to open that conversation and started to make that, started having that discussion about lifestyle, and to be honest, I think most people actually are in this day and age, I think people are actually pretty aware of the futility of a lot of our medications perform, and a lot of the medical care that we do in chronic care management. So it's not too much of a leap for people to really come to that. And oftentimes patients are extremely relieved when I tell them, that that's not my first approach. That's not really the direction I want to go in. The challenge then comes into, well, what do we need to do to do otherwise? And so there's kind of 3 different type of people that I meet that are interested in lifestyle changes. There's the type of person that knows what they want to do, may not necessarily be what I would recommend, but they know what they want to do, and they really just need some encouragement. They really just need kind of a kick in the butt. And then there's a second type of person that, they're really motivated, they really want to do something different, they don't really know what to do. They either need, guidance to, either watch like a movie like Forks Over Knives, or go to, my dad's website or Forks Over Knives website, just to get some information about either from different books or different perspectives, some recipes. And then there's people that just run with it after that. And then there's a third type of person that really needs more structure and needs more kind of a prescriptive nature. So needing a program like what we do here, or my dad's immersion program, or other immersion programs that are around the country, to give people that more prescriptive and guidance nature. And so I think that those are kind of the ways to kind of help people kind of move along in that direction. And it kind of depends on the type of person that it is. I think that things like ongoing support can be helpful for people. And so that's one of the things I try to incorporate in what we do here in the outpatient practice, is having that kind of touch points, whether it be in a group visit or whether it be on a one-on-one individual basis as well. Mm-hmm. But to encourage people to make that change, it really comes from that internal motivation. And what I've learned kind of a couple of things. I mean, it's similar things that my mentors have told me before, is that there's certain types of motivations that are strong motivators, and certain types of motivators that aren't necessarily as strong. I remember one of the things that from Dr. Dean Ornish, he said in one of his lectures, and it's something that speaks really true to what I've seen as well, is that fear is not the greatest motivator. So trying to scare somebody into making these changes doesn't usually have lasting results. Other things that I have seen that aren't the greatest motivators are things like oftentimes when people are only looking just to lose weight, because there's so many different ways to lose weight. If they can either do it by taking a pill, or maybe having a surgery done, or not necessarily giving up all their favorite foods that they've grown up loving, that can seem a little bit more easy for them to do. So I haven't found that to be a good motivator. Or withholding something. So withholding like a surgery, or withholding something until they lose this weight, or doing something, I haven't found that to be a good motivator. The best motivators have really been things like, I don't want to feel sick anymore. I don't want to feel unwell. I don't want to end up like my mom and dad, or my grandma and grandpa, or I just want to feel better, or I want to get on the ground and play with my grandkids. Things that are just, they have a kind of a different mindset of making these type of changes.
Right, like lifestyle.
Yeah. Yeah.
Well, we will open the chat box soon so that people can type questions. I do have a few questions from a few people, kind of fun trivia questions that I want to ask you really quick. You don't have to expand too much, and then we can go into more medical type questions. Would you tell us what it was like to grow up with two of the most prestigious and admired people in the plant-based world, your father, John McDougall, and your mother, Mary McDougall?
Well, I think, as a kid, you probably don't really even realize or grasp that kind of idea of what that means, what it means that your dad's written books or had, been on TV or a radio show. It probably seems more like the norm. I mean, but so I don't think I really completely grasped it in that sense. And also, as a kid, I remember, I didn't really even think much of the fact that, that we just eat plants at home, and, whole grains and legumes. It just didn't really capture until you start going to school and you have other people kind of make comments, is the only time I think that you start kind of realizing that things are a little bit different. But, it never, I don't know, it just didn't really bother me. I think that part of that is, the way that my mom and dad kind of had, how the household was set up, is that it really wasn't like a dictatorship or, forced upon me. It's just that this is what we eat at home. This is what we bring into the household. But as I got older and what I did on my own, it wasn't really like, that I was punished or anything like that. If I was at a friend's house and I ate some, it was more like, okay, but this is what we have at home. We have beans and rice and, and vegetables, and this is just what we eat. So that's kind of how I grew up, and, really trying to treat whatever it may be, whether it be sweets or meat or dairy or other type of rich foods, have always been treated as delicacies in my household as I grew up. And it's the same way that I do the same thing with my kids. It's not, it's just that this is what we eat at home. We have, beans and rice and pastas and, vegetables, and, that's what we eat. But if my daughter wants to try something, I'm not going to, it's not like she's, I'm never going to judge that at all.
No.
And it's just more treating these things as delicacies. We have, cake on birthdays, we have turkey on Thanksgiving. And that's how I was raised. And that's kind of how the same way that I raise my kids as well.
How many kids do you have?
I have two kids. I have a 3.5, almost 4-year-old girl, and I have a boy that's going to be a year this weekend.
Oh, wow. That's a handful.
Yeah.
Okay, now one question from me, and then we'll open it up. What advice do you give to young doctors and other healthcare professionals that are just starting the career, or they haven't graduated yet, and they really want to make a difference in the health of their patients, and but they do still have to go through the education that is based on other traditional approaches?
Yeah. When you say that, it actually brings up another thing that I think about too, and it kind of goes along with the lines of what I'm seeing in my patients as well, is that I think that people are very open to the idea that, maybe we need to take a different approach and really focus on lifestyle first. And they've become very, open to this, where, maybe 10, 20 years ago, that wasn't something that was as approachable to talk about or really bring up as a form of treatment, as opposed to here's a medication. I think the same thing has happened in the medical education as well. And so, I remember stories that my dad would tell me about, his experience with bringing up, a diet has anything to do with disease, and he'd be, laughed at and he'd be called crazy for the idea that what you ate has anything to do with your health. That's changed. I mean, I see it in my medical education is that philosophy has changed, that we really do have come to realize that lifestyle does play a big role. So we've made that transition, I think, in the last 20, 30 years. I think where we're at right now is that we just don't know what to do. And I think that's where people are, we don't have an agreement upon, I think, in the medical community about what is the answer now. We have come to the answer that, yeah, food has something to do with it, but what food specifically? And that's where I think a lot of this debate comes in the media and also the medical literature as well. Even though I think that it's very clear if you take a big picture approach of looking at the last 100 years of nutrition literature and medical literature, is that it's pretty consistent, that the literature supports that more fruits, more vegetables, more whole grains, more legumes promotes better health. The other shift that I've seen too is that I think that, at least in my colleagues and, when I went through residency, is that we've come to the idea that there is a lot of futility in what we do, and it doesn't necessarily make big changes and big outcome differences in what we do. So I think that a lot of new doctors and new residents come out of medical school, some of them a little bit more feeling like they don't know what to do. But I think a lot of that opens up the idea of, hey, there is this idea of lifestyle medicine and really focusing on, food as medicine, and they're very open to that idea. For people that have kind of, been bitten by the bug of food as medicine and plant-based nutrition, and they oftentimes are challenged by time limitations of office visits or other type of practice constraints that they don't feel like they have enough time to be able to educate their patients or share this great wealth of information about how they can improve their health. So things that I've kind of suggested to people over the years, and for people that are in whether they're in residency or whether they're in a private practice, and they feel this constraint in time, is that just suggest to the patient, recommend a book, recommend a movie, just be like, hey, why don't you go home and watch Forks Over Knives? If you have any questions, let me know. Or, somebody who has heart disease, be like, I got this great book. It's called Prevent and Reverse Heart Disease. Take a look. It's just giving them, just kind of opening the door and just kind of inviting them to start having this conversation about food. But it can take 2 minutes just to kind of start bringing this up and starting this conversation. And you'll find that, probably 1 out of 10 people will really start, listening and start taking an approach. And, that doesn't seem like much, but it really is very rewarding when you start having more and more of these people start listening over time. If it's 1 in 10, then maybe it's, then you have 1,000 patients, we're up to 100 people that you really change their life. Mm-hmm. The other thing that I've suggested, I suggested one of my good friends and colleagues is actually, he's an inpatient hospitalist. And I've also suggested this to a surgeon colleague of mine too, is that you have a captured audience when somebody's in the hospital. Why not suggest they watch Forks Over Knives while they're in hospital? Or, you suggest a website. So I've actually had, one of my surgeon friends actually has purchased extra copies, and he actually has been giving it to patients while they're in the hospital recovering. And then I've had one of my other good colleagues, he actually has on his discharge summary, the after visit summary, that you give instructions to patients. In the instructions that he gives them, he actually has like information about like, hey, watch this movie, go to this website, just to kind of bring that up to them.
Oh, wonderful. Wow. Very good. Thank you so much for that insight. Dr. McDougall, just a couple of questions, quick questions, and then we open the chat here. Someone wrote about this lady who had not a serious case, but she had melanoma, a very small spot down her leg, and her doctor has told her that vitamin D is one of the vitamins that really is important for fighting cancer, and he has prescribed, I think, I'm quite large doses of vitamin D. What is your view on this vitamin D issue?
I mean, to my knowledge, vitamin D supplementation has not had outcome data to suggest that it changes the difference of mortality from cancer, or whether even incidence of cancer. There's a lot more associations with vitamin D levels than actually and then vitamin D supplementation fixing those problems. Like, for example, low vitamin D levels have basically been associated with basically everything across the board you can find. I mean, whether it be a higher risk of heart disease, higher risk of cancer. But conversely, I mean, like, people think that, like, you can infer from that if I just replace it, then obviously that would decrease that risk and decrease the risk of heart disease or cancer and so on and so forth. But to my knowledge, that hasn't been shown. Even though we may have seen these associations with lower levels in the blood, we haven't seen the converse, which is that if I replace it with pills, then I get the opposite effect. So, I mean, I think that there's just a lot of other things that contribute to vitamin D levels. So, for example, as people get heavier, their vitamin D level goes down because the vitamin D gets stored in their fat cells. Well, we also know that obesity is associated with higher risk of cancer and melanoma and heart disease. So what came first, and what was the specific cause? We also know that chronic inflammation lowers vitamin D levels too. So chronic inflammation like arthritis or heart disease or diabetes. I mean, so there's just a lot of these other things that we're not taking into account when we're talking about vitamin D levels. So that's why I'm very cautious about vitamin D supplementation and the benefits that are claimed, because I don't think that those things have been well worked out yet.
Mm-hmm. Okay, very good. Someone here asked a question. He said, if you could please, if it's possible, to give a yes or no answer. I'm not sure if this is possible, but here's the question. Does a plant-based diet center around starches like your father promotes increase triglycerides?
So simple sugars. So like things like fruits or processed foods or other type of basically short sugars can raise triglyceride levels. In the study that my dad and I published, we found that people who had elevated triglyceride levels eating a starch-based, plant-based diet, their triglyceride levels, dropped tremendously. I mean, I had a patient the other day. I remember she had a triglyceride level of 800 or 850, and the next check a couple weeks later was 450. So I mean, like, it's very common that you'll find triglyceride levels will drop very well on a plant-based diet. Oils and other fats are other primary reasons that triglyceride levels are elevated. And so, what I do is I recommend a standard, starch-based, plant-based diet for my patients. I watch their triglyceride levels. If they find that they are, if they're elevated after they've removed the processed foods, they added oils, the animal fats, and their triglyceride levels are still elevated, I will recommend that they cut down to a smaller amount of fruit intake and limit refined carbohydrates.
Right. Okay. Very good. One more question before we do the chat here. What can be done on the issue of sagging skin? This was a question presented by a lady that lost a lot of weight, and that's this question.
I mean, if it's very significant, I mean, surgery would be one way of doing. That would probably be the only way of really taking care of it. Probably other ways, but surgery would be one way of doing it. I don't see it as often as when people do lose weight using a starch-based, plant-based diet, and that's because it's a little bit slower. It's also done, I think, in a more natural way of doing it, so it allows the skin to be able to heal and shrink down. And so I don't see large skin folds and skin flaps in most people that lose a lot amount of weight. But if there is significant amounts, surgery would be one way of doing it. There may be other ways that I'm just not as familiar with either.
All right. Feel free to, some of these questions I know that may be a little bit too specific. Feel free to let me know that if you want me to move on to another type of question. But here's one by Kim. What would you recommend for someone showing some signs of autoimmune diseases, a lot of joint pain, inflammation, probably leaky gut, and the yeast overgrowth? Yeast other than Candida? Would root vegetables need to be avoided for a bit?
I mean, I don't know of any specifically of root vegetables that need to be avoided. You know, I mean, like, I know that people talk about nightshades as kind of one of the things. I mean, I think that typically kind of my progression through, like, you know, diet is that, you know, I recommend a kind of a standard, you know, starch-based, plant-based diet, you know, minimizing, added sugar and added salt and no oil, and minimally processed foods. That's kind of my starting place. And then if people aren't having completely relief from that, my next step is to remove gluten. And so wheat, barley, and rye, I remove those from the diet and see how that kind of takes the next effect. If that doesn't seem to resolve the symptoms, whether they be allergies, joint pains, people sometimes doing an elimination diet can be beneficial. And then you can find out what specifically you know, is the culprit. And, you know, sometimes it is the nightshade family, which are, you know, the potatoes and tomatoes and eggplants. But, you know, I don't usually just start there. I usually kind of take a stepwise approach of the more likely culprits, which are oftentimes like dairy and eggs and meat. And, you know, and then gluten is another one that is probably, you know, the next step on the lower of the list.
Why would, going back to the previous question, why would fresh fruit be, someone is asking, bad for triglycerides? She says that, or he, maybe he can see how oils could be bad, but why fruit?
It's just that the liver produces the fat from the simple sugars. Is what happens. I think it's specifically the, I'd have to go back. I want to say it's the fructose in it, but I might be incorrect about that. But yes, the simple sugars do seem to get converted into triglycerides from the in the liver.
Right. Okay. How long does it take for someone with diabetes to see a change in numbers once they start a switch to a completely plant-based, oil-free diet?
Usually within about 2 to 3 days. So I see people get a lot of drop in their blood sugars in about 2 to 3 days. It is. You know, sometimes, I mean, oftentimes I have to decrease insulin levels within 2 to 3 days, somewhere between 20% to 30% sometimes. But people can have quite significant drops. I mean, when you know, I remember times, you know, when I was working at my dad's program, within 7 days, I mean, I'll see drops anywhere from 50 to 100 points. You know, there's patients that I've taken through with my program here, seeing, you know, on average, usually about 50 to 100 points after about 3 weeks or so. But it does happen pretty quickly, even without the weight loss. And then I don't see that people completely reverse it completely, you know, like in the first like couple days. I mean, there's some effect just by the food that people are eating that's going to raise those blood sugars. And that gets changed when you start changing your diet. But then there's the other added effect of actually all the fat storage that needs to come off that's contributing to the insulin resistance. And so over time, as people are losing weight, their insulin resistance will continue to improve and help improve their blood sugars and their handling of sugar. Because diabetes is more of a sugar handling problem, not a too much sugar problem. And so it's just about how they're handling sugar, and the fat that people eat and the fat that people wear are two of the bigger contributors to the sugar handling problem.
Mm-hmm. All right, very good. Someone says here that we're already following the starch solution. Which foods within that help heartburn and chronic pain?
Like what foods like help specifically, or?
Wait, maybe we should ask this person. Let's see, who is this? Paul. Maybe we should ask Paul to clarify.
I would think about switching it around a little bit and think about more of what foods like on a plant-based diet could be contributing to heartburn. And I would encourage, you know, that the listener to. My dad wrote a great article in his newsletter called "My Stomach's on Fire," and I can't put it out, I think is what it's called, but. It talks about things like, you know, citrus foods, licorice, peppermint, what other things? Chocolate, caffeine, those type of things that are still plant-based that could be contributing to continued reflux type of symptoms. if people do have what's called a hiatal hernia, and if that they developed a hiatal hernia before they change their diet because of, oftentimes it's because of chronic constipation and that pressure of pushing the stomach up, they can develop a hiatal hernia, and that will lead to chronic reflux even after you've changed your diet as well. But it's going to continue to, oftentimes people do see a lot of benefit, even if they do have that from their dietary changes. But eliminating those things like the citrus foods and the peppermints and the and chocolate and coffee and caffeine can be helpful.
Right. Everybody, there are so many questions. We could be here for 3 hours. So I'm sorry, we're going to choose the some of them. If you want to email questions, you can always email them to me at webinars@drmcdougall.com, and I save those questions for webinars later. Dr. McDougall, one question that I think a lot of people are having is, what do you do when someone is plant-based? They don't consume any oil, and the cholesterol is still high. What kind of measurement do you take? Do you look at their diet more closely, or do you prescribe any medication?
I mean, it just kind of depends. I mean, so when I look at first I kind of take a step back and I say, well, why do we even care about cholesterol levels? So cholesterol levels, why do I care about them? Is that they increase your risk of heart attacks and strokes. But there's also a lot of other things that contribute to heart attacks and strokes. So besides high cholesterol levels, also high blood pressure, high blood sugar, increased weight, poor diet, sedentary activity, smoking, family history, and there's probably a couple other ones that I'm missing as well. But so how I look at when people are trying to change their diet and they've changed their diet and the cholesterol level is not coming down, is everything else that we may have control over optimized. So is my weight optimized? Is my exercise optimized? Is I'm not smoking? Is my blood sugar optimized? Is my blood pressure optimized? Because then if everything else is optimized, the risk that cholesterol level that is elevated, probably based on genetics, is going to be very minimal. Now, if you want the absolute most risk reduction that you can have, maybe taking a cholesterol medication may decrease that another small fraction if they're looking for that extra risk reduction. But I'd say just kind of looking at how do I reduce the risk the most, you got to look at the big picture of things. And so that's the approach that I take in the conversation that I have is, are we doing everything else? If we are, then how worried are we at this level? And so I would just kind of look at all those different type of things.
Right. Someone here is asking about, have you had cases where people have kind of severe cases of constipation, even though they eat a lot of potatoes and rice and beans? And what would you suggest for someone who is suffering with that?
Add more insoluble fiber.
Okay, more fiber.
Insoluble. So there's two different types of fiber. There's soluble and insoluble fiber. Typically, soluble fiber is going to slow things down a little bit more. Insoluble fiber might speed things up a little bit more. And so I find that that when people do have a little bit slower bowels and they want to speed it up a little bit more, so adding some more insoluble fiber can help kind of regulate things a little bit more.
Right. What examples do you give of insoluble fiber?
Okay. Well, now I'm going to have to take a look here.
Okay. Well, that's okay. While you take a look, someone is asking about drinking decaf coffee. Having heard your father, he says that it raises cholesterol. What do you think that it interferes with a plant-based diet?
So yeah, I remember reading that in my dad's one of my dad's earlier books. I don't hear it talked about as much, but it's something on the coating of the bean, is my understanding, that does raise cholesterol levels of the coffee bean. And I believe it occurs whether you drink caffeinated or decaf, that it's both of those could contribute to elevated cholesterol levels.
Do you even recommend people drinking coffee or tea?
I think that I think tea has some benefits that can come with it. I was just reading Dr. Greger's new book, and he talks a little bit about some benefits of actually even drinking coffee. And so I don't necessarily know how horrible it is. As long as your cholesterol levels and blood pressure looks okay, and it's maybe not horrible. I think that oftentimes, it's what people put in their coffee is probably more of a contributor to poor health than really probably the coffee beans themselves. But it's some would consider it a drug, a vice. And so you just have to kind of think about those things as well.
Do you have an opinion regarding CoQ10?
I don't know a lot about it. I think there was a recent article that didn't really show much benefit by taking it. And it was just published, I think, about a month ago.
Right. Okay.
I don't have a lot of opinions, but
all right.
We'll
Linda's asking, what was your favorite type of dinner?
Oh, I only eat five different things. So I eat very, very simply. Always my favorite is beans and rice. You know, like I love, you know, bean and rice bowls with some salsa and corn, tomatoes, some lettuce sometimes, avocado slices. That's like one of my favorites.
Do you eat brown rice or white rice, or it doesn't matter?
I eat a mixture of both. I try to eat mostly brown rice, but if the white rice is all I have available, it's not. I don't look at it as a deal breaker. But I do try to eat mostly brown rice and whole grain noodles. I always try to eat as most whole as I can.
All right. All right.
Another one of my favorite ones is we do soba noodles with a miso soup, like a miso soup with a soba noodles with spinach and tofu and mushrooms. And we do sometimes sweet potato, boiled sweet potatoes in it too. And that's one of my favorite ones. But yeah, I eat pretty simply and pretty consistently. And why do I do that? Is I just think it's more predictable of what it's going to do to my weight, cholesterol, blood pressure, and just keep me keeps me consistent and keeps me on my path by having a very kind of narrow repertoire of what I eat.
Right, right. Someone is asking about the title of the book by Dr. Greger. I think is How to Not Die.
How Not to Die.
How Not to Die.
It's a very good book. I mean, he is entertaining, and he really digests a lot of information into I mean, it's just very digestible. I really enjoyed it. It was a great book.
Yes, I got it, and it really is. I am typing it here so people can see it. And of course, we recommend highly the Starch Solution, which of course is written by your father, and he's working on a new book.
Yeah.
Are you thinking of writing a book anytime?
I don't know. I don't think so. But,
okay.
You know, it's something that I debate about, but it's really just not. You know, it's not really my interest right now. I mean, I'm very busy. You know, with the practice and still practicing medicine. Really enjoy seeing patients and running my practice. And so I'm not there yet. I mean, maybe after I have 10 to 15 years, you know, of doing this under my belt, maybe I'll feel like I have something that would be unique enough to share. But it's just, you know, there's just so many books out there now, and you know, basically anybody's writing books, and you know, share any type of opinion that they have. And so I just feel like, you know, the difference I can make right now is just seeing patients and building a practice that I can see more patients and train providers. And you know, that's my goal. One of the goals of why I joined this practice and this company is really to try to create a model that can be replicated. And so that's one of our goals, is really to try to create a practice that can be replicated anywhere.
Yes. All right, Dr. McDougall, I'm going to ask you one more question, then we will have to close this webinar. And I hope that you will consider being a guest sometime in the near future, because people are really enjoying hearing from you.
Good.
So can you please tell me, says Melanie, what causes inflammation?
Many different things cause inflammation. I mean, it could be anything from smoking to pollutants to, you know, fat, you know, saturated fat. I mean, I don't think we completely understand all the different things that cause inflammation, but I think it's a great question. I think, you know, oftentimes people say inflammation causes this disease. True, but what caused the inflammation? What was the actual event that's causing the trigger of this inflammation from occurring? And I think that, you know, like my dad has always said, the thing that we're most exposed to is the food. I mean, that's where most of our exposure to the environment is, through the food. So whether it be from additives in the food, or whether it be from, you know, antibiotics in the meat, or pollutants in the meat, or other type of things that, you know, come in our food, or pesticides, or, you know, fats and proteins. I mean, all those things potentially could be triggers of inflammation in the body. And I think that's what we need to more focus on, as opposed to how do I cut down this inflammation by pills or whatever it may be. We need to really focus on what's causing this inflammation in the first place. And I don't think that's the question or the conversation that's being had oftentimes. We know of one, which is smoking, and that causes inflammation. Very
good. Well, we will close for today. Next week, please, everybody register for Dr. Lyle's webinar. And the following week, Dr. John McDougall will be back. And thank you again, Dr. Craig McDougall, and I hope you have a wonderful day. And remember, everybody, you can actually age backwards if you eat plants and if you eat starches. So with that thought of aging backwards, I leave you all, and have a great day. Bye-bye. Thank you.